I'm Dr. Samuel Acuff, a research scientist at the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm talking with Dr. John Kelly today, who is the founder and director of the Recovery Research Institute and a professor of psychiatry at Harvard Medical School. Dr. Kelly?
Good to be with you.
Yeah, I want to talk to you a little bit today about the Opioid Response Network. What is the Opioid Response Network?
Well, as you know, we've been reeling from this opioid epidemic, so-called opioid epidemic, with hundreds of thousands of people dying from poisoning deaths related to opioids in the last 25 years now. Coming up for 25 years, this increasing casualty rate related to opioids. We've all been reeling from it, grappling with how do we address it, how do we curb it, how do we stop it. So the Opioid Response Network is part of that initiative. It's a federally funded initiative to try and address this opioid epidemic, which is also extended to a stimulant poisoning epidemic by way mostly of methamphetamine and the combination of stimulants and opioids. So it is a federally funded network of roughly 40 to 50 national partners, of which the Recovery Research Institute is one. And it's designed to help really sensitize clinicians around the country, as well as community partners around the country. In other words, sensitize them by way of making them aware of the various aspects of addiction, the latest trends in opioid and stimulant use and use disorders, as well as overdose deaths, as well as empower them to make a difference to their patients. So this is done through providing technical assistance, on-site training, education to their staff and administrators, so that we can have a bigger, more extensive impact in this crisis. So that's why it was started, and it's been going now for several years, essentially doing that. So providing technical assistance and education to these frontline providers. The good news is it's completely free to get this access to this training and technical assistance. So that's really good news, because it is taxpayer funded as part of the federal initiative in addressing these problems. People can go online to the opioidresponsenetwork.org and put in a request for technical assistance in any aspect, from screening to assessment to brief intervention to full-on interventions at different levels of care, and get technical assistance from these 40 or 50 expert organizations around the country for free. So it's a really great initiative, and we're very proud to be a part of it.
Yeah, incredible resource. And it sounds like, could someone come out to your organization and deliver a training, or would this be, tell me a little bit more about,
right. Yeah, so it could be hands-on, on-site training where people will come and provide, training in, naloxone distribution to, best practices in buprenorphine care, to methadone maintenance, to contingency management, all these different types of evidence-based practices designed to address these disorders. You can get access to in person or online as well. We do a lot of Zoom training, of course, online, using digital tele training, as it were.
Right.
So all of that's any of those things are possible, and we encourage people to sign up, because this is what it's for. We want people to become sensitized and empowered to make more of a difference.
Incredible resource. And what's the role of the Recovery Research Institute?
So our role as one of these partners, national partners, is to do that, but within our particular specialty. So our specialty at the Recovery Research Institute is on recovery science. So in other words, how to sensitize clinicians and empower them to make a difference vis-a-vis the recovery side. So after an acute care stabilization, what's next? To help clinicians, for example, become more aware of the repertoire of options now that they have at their disposal that they don't even know about. Things like recovery community centers, recovery residents, and recovery coaching, and the recovery-ready workplaces and recovery supports and educational settings. Many clinicians are unaware of these resources, which are right on their doorstep, that are available for free, and to which they can link their patients, but they're just not aware of it. So part of our role has been educating the clinical workforce of the availability and accessibility and free flexibility of these resources in their own community, so they can extend and amplify the effects of the treatment that they provide, as well as educating them as to, again, the nature of what these services are and what they do. As I mentioned, things like recovery community centers. So helping clinicians and clinical systems understand more and help them to create linkages to these services to amplify the effects of the treatment.
Yeah, that sounds like a wonderful resource. This is opioidresponsenetwork.org.
Yes.
Great, thank you so much.
Yeah, thank you.